living at your optimal health potential? Being able to do everything you wanted while full of energy, like when you were a kid? Ironically, you were probably healthiest as a baby, constantly growing and learning new things. Unfortunately, nowadays, most people are weighed down by the modern, often unnatural lifestyle. We have 3 types of lifestyle stressors that we have to deal with on a daily basis, and if our bodies are not in optimal shape, it can all become too much. These day-to-day stressors can be seen in 3 categories. They are physical, poor posture, computers, desk jobs, car accidents, bicycle falls, sports injuries, even earlier events such as childhood falls, pregnancy, or the birth process. All these stressors have an accumulative effect on the body and health. Chemical, medications, chemical sprays, detergents, drugs, additives, and preservatives. Emotional, stressful environments, deadlines, overtime work, depression, anxiety, toxic relationships, loss of a loved one, or any situation or thought to which we didn't respond in a positive way. Stress can be positive if we adapt well to it, but if it exceeds our ability to adapt, then slowly over the years our health degrades, until a small event such as a wrong movement elicits a pain body signal. How can we break this cycle? There are 3 stages involved in returning to the best version of yourself. Keep in mind the amount of chiropractic care you choose to do is completely up to you. We're here to serve you. However, these 3 stages are how our bodies and minds heal best. The first stage of care is known as intensive care. In this stage of care, it is likely your spinal bone is out of its normal functional position. A chiropractor provides a quick, specific adjustment to align the spine, and then what happens? Your body has muscles, tendons, ligaments over to the side of the spine which have muscle memory. So within 24 hours, the spine pulls back into its old position. Then we adjust it again, and the body pulls back again. So what do we need to make a correction? The goal during this phase is that your spine spends more time in its new ideal position rather than in its old position. By repetition, the new position can become the new normal for the body. This is why the best adjustment frequency is 3 times or twice a week in the beginning. This stage can last anywhere from a few weeks to a few months, and is the stage where people often mention that they notice their bodies are starting to move better. At the end of intensive care, you will be eligible for corrective care, which is typically once a week. This is where we stabilize the spine and nervous system so that the changes last as long as possible. During this stage, your energy will increase, the body becomes stronger, and you will better adapt to the stressors in your life. This stage takes around 3 months. This is very similar to the changes in time frame in orthodontics. The corrective stage is often the stage where people mention that their bodies start to feel better. As your body goes through the corrective stage, it is not uncommon for the old accidents, injuries, and traumas to show up again. The health journey is rarely a straight line upwards. This is known as the unwinding process, so every 12 visits throughout care, we have progress session where we sit down together and repeat the tests we did in the beginning, observe progress, and see how the body is holding the adjustments. Later, if you are happy with your care, the ultimate goal of healthcare and chiropractic is optimized care. This care has the goal of optimizing your body and mind to discover optimal ways of living. It also has the goal to protect any progression made, make sure we don't slide backwards, and provide maintenance to the body which allows you to fully do the things you love to do. Chiropractic is a way of life. You will find the majority of people and families who come to our practice are coming for this stage and reason. This is why it is so important to have children under chiropractic care. It is our responsibility to give you the best adjustments that we can so your body can heal and regenerate. We also consider it our responsibility to try to help you break some of the bad habits that may be promoting the problems. So please think of yourself as a team with your chiropractor for the best results. When assessing our members that get the best results, it is most often the members that 1. Keep a rhythm on their adjustment schedule. Just like going to the gym or building muscle, chiropractic is a physiological and neurological change, and keeping to the adjustment schedule is the most important factor in creating this change. 2. Engage with the habit tracker and break any bad habits the chiropractor may point out. 3. Take advantage of seeing a primary chiropractor as well as occasionally a secondary chiropractor in the studio. Although seeing one person is often comfortable, having occasionally 2 different chiropractors on your case nearly always works better.